In this video, I'm going to go over what you need to know before you start your laser hair removal journey. Hi everyone, I'm Dr. D. I'm an aesthetic physician in the DC metro area, and my practice, Delight Medical and Aesthetics, focuses on treating skin of color. So a laser hair removal is a very popular service in my practice, and a lot of people usually have so many questions during our consultation process. So I decided to basically create a video trying to answer as many questions as possible so that people have a good head start before they go in for laser hair removal consultations. So before we start, it's important to understand what laser is, how it works, things like that. So basically, laser is a machine that will produce a wavelength of light, and that light is targeting pigment, specifically melanin, and usually we want it to target melanin in the hair follicle. So one wavelength targeting melanin in the hair follicle, and once those two meet, it will destroy it. Okay, so that's basically how laser works. Now, will the laser remove all your hair in one setting? No. Your hair grows at different growth phases, and so because of that, you usually are going to need multiple treatments to be able to get most of the hair removed. It's important to understand that laser hair removal, even though it says removal, it's more of laser hair reduction, because it's going to be able to target 80% of the hair follicles, but 20% of your follicles will stay dormant, and those can pop up randomly. So usually whenever you do the number of treatments that are required, it could be 10, it could be 12, then you might need maintenance treatments where you come into the office once or twice a year to get treatment. And those maintenance treatments are targeting the hair that is more, not the 80%, but the 20% that's the dormant hair. So when you come in for laser, it's going to be important to let us know what your goals are. Like, why are you coming in for laser? Because again, like I said, if your goal is to get rid of the hair completely, then laser is not going to get rid of all of your hair, only 80%. The other question is usually going to be, do you have any skin concerns that you're hoping will be improved by laser hair removal? So the most common one that I see in the office is ingrown hairs, but we also use laser hair removal for patients who have HS, patients who have something called a pilonidal cyst, and some other medical conditions as well, where it's important to remove or reduce the amount of hair on the body to mitigate complications of that. So it's important to let us know what your goal is, and then we can tell you if we are able to achieve the goal. One of the other ones that I forgot to mention was PCOS. And the reason I bring this up is because my treatment goals for PCOS are always going to be different. I always tell my patients, if you have PCOS, then my first goal is to get the hair to go from thick to thin. And that usually will happen between 2 or 3 sessions. And then after that, the next goal is to focus on removing the hair that's left. And so it's important. This actually brings up another point where as we do more treatment, you're going to have changes in the settings of the laser. So the first 2 treatments, or whenever the hair is thick and has a thicker density, you're going to experience a bit more pain because the treatment is just more painful. There's more melanin in the hair, and so it's going to be a bit more abrasive. But as you do more treatments, so 3rd, 4th, 5th treatment where the hair is very thin, we have to increase the power of the laser because now your hair is not as melanated, and so you need more power to try to eliminate that hair. And typically in my office, the treatments are going to become hotter, not necessarily more painful, but we are just applying more heat to the skin to try to target the hair and the pigment in the hair. So it's important to understand that the way the treatments are going to be in the first few sessions is not going to be the same. It progressively gets hotter, and for some people, depending on your laser, it progressively gets more painful. The next question that we usually get is, how many treatments do you need? And that is going to depend on the area, but typically I like to break down the number of treatments based on hormonal hair. So I coin it either the hair is hormonal or the hair is not hormonal. And so for me, hormonal hair is facial hair in women and men too, but we'll talk about men later. But facial hair in women, maybe chest hair, hair around the areola, happy trail or belly hair, Brazilian hair, all of those underarm hair, those hairs tend to be hormonally driven. And by that I mean before puberty you didn't have thick hair in those areas, and after puberty you did, and so those hairs became thick because of a hormonal influence. And because as a woman we're typically not trying to change your hormonal levels, then we have to work with your hormones to try to eliminate the hair. So it tends to take a little bit longer to get rid of the hair in those areas, as opposed to your legs, for example, that is not hormonally driven, and so you might get treatment. Your treatments might not take as long, and they might be more effective compared to the other areas. Typically, the treatments will be done every 4 to 10 weeks. That's going to depend on the area. For me, the face is usually 4 to 6 weeks, and then the body is usually going to be 6 to 10 weeks, depending on the number of sessions that you've had. During the consultation, it's going to be very important to let us know the previous methods that you've been using for removing the hair. So are you shaving? Are you waxing? Are you threading? Are you using hair removal creams? All of this is really important because it's going to help us determine when you can come for a laser treatment. And also, if you need to stop some of these treatments, then we will recommend that as well. As an example, a lot of people prior to doing laser will be waxers. And so we always tell them you might have to wait a month for the hair to completely grow out, and then you shave prior to coming in. The next question is, does laser hair removal work on all hair types? And the answer is no. So because laser hair removal requires some pigment to be in the hair follicle, it will work best on dark hair and pale skin historically. But if you have dark hair and dark skin, we can also do laser hair removal. I'll talk about the type of laser we'll use in a minute. But if you have blonde hair, or if you have gray hair, or if you even have like red hair, typically laser will not work well for you. Okay, and so in that case, you might benefit from something like electrolysis. During the consultation, I am also going to ask you about medications that you're taking. And this is really important because some medications can be photosensitizing. Particularly the medication that I'm usually cautious about is antibiotics. And so we're always going to ask you, not just during consultations, but before every treatment, to know if you're on new medications, just so that we can mitigate any risk of post-inflammatory hyperpigmentation due to the use of these medications. We will also want to know what products you're using in the area. If it's a product that can be sensitizing to the skin, we might ask you to stop using it for a few days to a week. So as an example, retinol, usually we'll ask you to stop it a week prior, and then if it's something like an acid, we might ask you to stop it a few days before. We will also want to know about sun exposure or tanning, because in my office, tanning is a contraindication to getting laser, because again, it's going to increase your risk of burns or post-inflammatory hyperpigmentation. So it's going to be important to either let us know if you're tanning, or let us know if you've recently been in an area where you've gotten a tan because you were exposed to the sun. So that information is going to be also very important to let us know. So what is going to be the best laser for different skin tones or different ethnic groups? In my office, I have a laser called the Splendor X. It is a combination of an Alexandrite laser, which is 755 nanometers, and a 1064 Nd:YAG laser. So with that, I am able to treat all skin tones. If you have dark hair and pale skin or light skin, then a 755 nanometer laser will be great for you. If you have dark skin like me, then a 1064 nanometer wavelength Nd:YAG laser will be the best option for you. Now, there are other lasers out there, such as a diode laser, which is an 810 or 808 nanometer laser. That also will work for people who have dark hair and pale skin. It can work for darker skin tones as well, but it can work for darker skin tones as well, but the person who is operating the laser needs to be quite experienced with treating darker skin tones, because they need to make adjustments for darker skin, And if the adjustments are not done correctly, then there's a risk of burns with a diode laser. So if you have darker skin and someone is using a diode laser, just make sure that they have a lot of experience treating darker skin tones so that you don't have to worry about the risk of burns with this particular laser. But if you have dark skin, then the recommendation is always going to be an ND-YAG laser, 1064 nanometer ND-YAG laser. And a little caveat is that not all ND-YAG lasers are created equal. So I would say the older ND-YAG lasers tend to be quite painful, and the newer technology is much better. So the other thing that you're going to want to know is like what type of laser is it, and the pain level, because some lasers are going to require numbing and some aren't. So in my office, I don't require numbing because my laser is newer technology, and so numbing is really not necessary. And another reason why I don't like numbing is because I need to know the feedback directly while you're there. So if something happens where you develop a bruise or a burn, I need to know right there while you're in the office so I can mitigate any issues, versus you getting numbed in the office, not realizing that you got a burn, and then you go home only to find out you had a burn, and it just makes the whole situation complicated. So in my office, we don't numb, but if you go to another office, they might have a different technology that is more painful and requires numbing. So this is going to depend on who you go and see. Contraindications. So the main contraindication is going to be the use of Accutane. Relatively, we don't usually treat patients who are pregnant, and then if you're breastfeeding, we can treat you, but we're a little bit cautious as well. So those are like the main things. So I'm going to walk you through the typical thing that will happen when you come into the office for treatment. So first things first, prior to coming in, obviously, we want you to shave the area. And then once you shave the area, we'll give you goggles to wear to protect your eyes from the laser, because the wavelengths are not safe for your eyes. And then the next thing we're going to do is we're going to use the laser to laser off your hair. In my office, we use a Splendor X laser, which comes with a Zimmer. And the Zimmer is a machine that basically pushes cold air onto the skin. So the cold air helps the procedure to be more tolerable. During the treatment, especially if it's the first couple of treatments, you will feel like rubber bands are being stung on you. And then after the treatment, sometimes you can develop something called post-inflammatory edema or erythema. Erythema is the redness you can have afterwards, and edema is actually swelling. And usually that swelling will go down. So after we do the treatment, if you have this swelling, we will put aloe on your skin just to help your skin cool down. Afterwards, we always ask you to have a hydrocortisone cream at home, because sometimes when the hair starts to come back, it gets really itchy and irritated. And especially with melanated skin, you don't want inflammation on your skin, because that can cause post-inflammatory hyperpigmentation. So the recommendation is for you to use a hydrocortisone cream afterwards, or when you have any sort of irritation to your skin. Now, if you have full-blown folliculitis, which is an infection of the hair follicles, then do let us know and we can prescribe an antibiotic for you. Now I'm going to talk about laser hair removal in specific areas. So we're going to start with the face, and the face in women. So usually women come in for laser hair removal on the face. Typically it's going to be lip, chin, neck, jawline, or full face. And a lot of times this is going to be hormonally driven, okay? And so whenever the hair is hormonally driven, like I said earlier, it's going to take much longer to get rid of the hair. And in this case, typically the hormone that is causing the problem is not a hormone that we want to continue to cause the problem. So it could be due to testosterone, or it could be due to insulin or insulin resistance. And so in either case, we're going to talk about what we need to do to help bring those hormones down, or bring your or help to balance your hormones because if we don't help balance those hormones, then you're not going to get good results with the laser. Now, like I said prior, if you have PCOS, we have two goals for you. The first goal is to get the hair to become thin, and I think that we're very good at doing that, but usually the problem that comes up is getting rid of the hair completely, especially if the hormone is still pushing the hair to grow. So that's why with face laser hair removal, it's very tricky. You know, we're not just doing laser hair removal, you also need to deal with managing the hormone that's causing the facial hair to grow. So that's really important. And this is also important for men. So if a man's coming in and has the beard and wants to get laser hair removal done, again, because in this case the man's testosterone is pushing the hair to grow, it's going to take a lot longer than normal to remove hair on the face. So this is just going to help you understand like expectations. Usually for men, it will take more than 2 or 3 treatments to get the hair to become thin. And then once it becomes thin, it will take another few sessions to remove the hair completely. And most times men are not trying to remove everything unless they deal with like really bad ingrown hairs that's causing scarring. But for the most part, it will take much longer to remove facial hair in a man compared to facial hair in a woman. If you have more questions about facial hair removal in men or women, just comment below and I can do a completely separate video on that. But I just want to touch on little things in different areas that are important to talk about. Another area where you might experience hormonal hair, especially in women, is going to be in the chest area, the areola, so around the nipple, the happy trail as well. And yes, we can do laser in those areas. It is safe to do it in those areas. Same thing, the first goal is to get the hair to go from thick to thin, and then after that we're working on eliminating the hair. But like I said, it's hormonal, so it tends to be very stubborn. A very common area that we treat as well is the underarms, and the reason why the underarms is very popular is because typically that's where people shave, and then that causes ingrown hairs, or they might get a lot of bumps with ingrown hairs basically. And so if you're doing laser hair removal in the underarm area, we will ask you not to use deodorant prior to coming in. So that's like the only thing that's important. We want you to shave before you come in, and then afterwards you can use deodorant. One of the other things for the underarms that's important is that usually people who have stage 1 or stage 2, Hurley stage 1, Hurley stage 2, Hidradenitis suppurativa, may have bumps and tunnels or even flares in the underarms. And yes, at least in my practice, we do treat those as well, but if it's at a later stage, then we will not treat it. And the reason why we treat it is because one of the primary reasons why you get flares is because of inflammation of the hair follicle. So we tend to do a lot of laser hair removal treatments on people who have HS in the underarms and in the groin area as well, which I will get to. So laser hair removal in the bikini, Brazilian, buttock area, typically bikini Brazilian will be, Brazilian specifically, in my opinion, is the most painful area to get laser hair removal. The reason for that is whenever we are treating the area, it's obviously very sensitive. And if we're treating around your clitoris and your clitoris does go into your labia, then it's gonna be not fun. Okay, so that's the only one where I'm like, people usually need to like be prepared for it. Again, the area of the hair is hormonally driven, so it will take a lot longer to get rid of the hair. In my opinion, I think Brazilian takes the longest to get rid of. And again, if you have HS, this is also another area where we see issues with ingrown hairs and HS. And yes, we do treat it, but if you have flares, then we work around it. So that's going to be specific to different places. At my office, we're very comfortable with treating HS patients, and so that doesn't stop you from getting laser hair removal treatments. Now, I will say that if you are going through your period, some people tend to be more sensitive, and so during that time frame they're gonna feel more pain. So we are open to adjusting your treatments around your cycle, just because obviously nobody needs to be in that much pain just to get rid of hair. So just keep that in mind. On my website we have like different breakdowns of like how we do laser. So we have Bikini, you have modified Brazilian, and then you have Brazilian. And for us, Brazilian is basically everything is gone, including we'll just use the colloquial term, the butt crack. Okay, so everything is gone. But then the modified one could be, some people want to keep the hair on the labia. They don't want to like go through that extreme pain of treating that area. So we have different options. You can check the website for more information on that. And then the buttocks we do treat as well. A lot of times, typically, we treat that area because some people have folliculitis, or they might have keratosis pilaris or KP, which I will get to on the legs. And so we treat the buttocks. It's very common to see folliculitis there. So if you get ingrown hairs there, then we might need to put you on antibiotics afterwards. But yes, we treat the Bikini, Brazilian, and the buttocks. The easiest place to do laser hair removal, in my opinion, is going to be the arms and the legs. And that's because typically those hairs are not hormonally driven. Typically, okay? Now, if you have PCOS, then your upper arms and your upper thighs might have thicker hair than usual. And then that is more hormonal hair, and then it just takes much longer to get rid of it. But typically those areas are easier to treat. Now, if you have keratosis pilaris, which is something sometimes called strawberry skin or chicken skin, then laser is going to also be a great option for helping with that, because one of the main issues with that condition is that you have high amounts of skin or keratin around the hair follicle, and it anchors on the hair. So if you remove the hair, there's nothing for that extra skin to anchor onto. And so once you do your exfoliation, you can get rid of the KP. So we do a lot of laser hair removal on the legs and the arms as well. So that's the only nuance with that area. The other thing, obviously, is like if you're doing laser in the summer, then those areas are going to be more exposed. So I recommend 1 to 2 weeks before or after laser to have sun exposure, just so that we don't have to deal with post-inflammatory hyperpigmentation. Okay, now I'm going to answer some frequently asked questions that I get. And again, this video, I'm going to try to make it as comprehensive as possible. If I miss anything, please ask me below, and I will make a second video just going over all the questions that you guys asked me, okay? Will laser cause infertility? As far as I'm aware, no. So laser does not go deep enough to go into any of your organs. It doesn't affect your uterus. It doesn't go to your ovaries. So it's not going to cause infertility. Will laser make me have more hair? So that is a risk, okay? That's one of the risks with laser hair removal. So there's a condition called Paradoxical hypertrichosis, and this is something that happens a lot in Middle Eastern women or women of Asian descent, sometimes in Hispanic women, and it usually happens on the face. So it's just something that's important to know, and the way to treat it is just to do more laser hair removal treatments. So that is a risk that you need to be aware of going in. If you have PCOS and the wrong settings are used, I think that can also cause problems as well. So it's going to be really important that the right setting is used, and in the first couple of treatments, as much hair as possible is removed with the laser, just to mitigate any risk of the paradoxical hypertrichosis. Can I get laser if I have PCOS? Yes, you can. I have tons and tons and tons of PCOS patients in my practice, and we get them great results. Again, as long as you understand that facial hair is not just facial hair, but it's facial hair plus a hormonal imbalance, and both things need to be tackled in order for you to get good results. So if you come and you only do hair removal and you don't do the things that I tell you to do that are going to help you with your hormones, then you're not going to get good results. Is laser safe for HS? So yes, HS, Hidradenitis Suppurativa, is a condition where you get chronic inflammation that can lead to flares, ingrown hairs, sometimes tunnels if it gets really complicated. And so we use laser hair removal to remove the hair because that is one of the things that causes problems. And we can use it on people who have early stages of HS, so stage 1 or stage 2. In my practice, I'm very comfortable with. Once it gets to stage 3 though, typically that's when you have a lot of tunnels. You might need surgery at that point, and at that point we are not going to be able to treat you. And it's also important to understand that with HS, we are going to treat your underarms, your face, your Brazilian area, because those hairs are thick enough where the laser can work. But if your HS is more common, or if you have flares under your boobs, for example, because of friction, then we're not going to be able to treat that area, because the cause of HS in that area is due to friction, even though it's because of the hair, but the hair in that area is usually vellus or thin, and so laser will not work in that area. If I get pregnant, will the hair grow back? So remember I mentioned earlier that some of the hair stays dormant. And so when you get pregnant, because you have a hormonal surge, or even when you go through really intense periods of stress, like COVID was one of them, then you are going to see some of that hair come back. It's not going to come back to like the way it was before you did laser hair removal, but you will get significant regrowth of the hair during hormonal surges in your body. Do you recommend at-home laser hair removal devices if you have dark skin? For me, that is an absolute no. So most of the home laser hair removal devices are IPL, and IPL is not a laser, it's intense pulse light that has potentially the side effect of removing hair. So it does work for laser hair removal. However, it is best for people who have light skin, like light skin, not dark skin. So it is best for people who have light skin and dark hair. It is not good for somebody who has dark skin. Like, it's an absolute no. And the reason is that if you remember, I mentioned earlier, laser is a wavelength of light that is a one wavelength and is targeting pigment, right? In the case of IPL, it's not one wavelength, it's just light and it's targeting pigment. But in this case, it's targeting a multitude of different pigments. So it could target the pigment in your skin, which will cause a burn. It could target the pigment in your veins or your vessels, which is what it's really good for. You know, for people who have pale skin, they might have like little blood vessels in their face that makes them very red, and so IPL is going to be great for targeting those blood vessels, right? But it's not going to work, it's not going to be good for dark skin because it's going to burn the surface of the skin, and it's also going to target the hair. So it targets so many different things. It has a scattered wavelength, and because it's not targeted, it's not a good idea to use it on darker skin tones because is going to cause a burn. And so it doesn't matter what is on the market. If it's an IPL laser, it is not safe for dark skin. It is not safe for people who have skin type 5 or 6. If you get a good one, it should come with a melanin reader, and if you use it and it doesn't work, then that company is a good company. But for the most part, they shouldn't be marketing this particular device to people who have darker skin. Okay, so that is it for today. If I missed anything, or if you have more questions, or if you want me to go in depth on any part of laser hair removal, just comment below and I will do that for you. If you're in the DMV area, my practice, Delight Medical and Aesthetics, we focus on treating people who have darker skin tones. We treat everybody, but that is our main focus. So if you're interested in getting laser hair removal done, then I'll leave our information below. So I'll see you in the next video, and please share this with anybody who is interested in getting laser hair removal. Bye.